All right, what's up, guys? So you made it to episode 4 of section 2. We're talking about neck and upper back. Today, we're going to go through self-treatment techniques and exercises that you can do for this region. So typically, we need mobility in through the upper back, and we need stability in our neck. That said, there are a couple neck stretches in here that you can do. We're going to break this kind of into two sections. So first part's going to be more about mid upper back. Second part's going to be more about neck. So let's go ahead and take a look at the first little snippet I got here. Just getting into that thoracic, those stiff thoracic segments with the foam roller. And typically, what I have patients do is pick like 3 or 4 different spots, and you're trying to pivot, kind of drape your body over that roller. It may not feel good, but and maybe you get a couple little pops, cracks. That's kind of resetting those joints so you can move a little bit better through there. I like to think in terms of groupings for all exercises. So let's take a look at the next one here. Most people know this exercise, rotational stretching. We call it open books in the clinic. I've got a few different versions here. Sometimes with the arm all the way out, bothers people's shoulders. My personal favorite is with the hand behind the neck. I feel like I can isolate my mid back better that way, and it more replicates another exercise that comes a little bit later, relatively soon. Um, this one, this prayer stretch here, yeah, it's a shoulder stretch, but what I find with that, if you can convince yourself to relax through your mid back, you can get some good extension through there, and again, some cracks, pops, and kind of restore some motion through there. Take it easy on your shoulders with that one. It's not for everybody. None of these are. Um, Okay, and then the thread the needle, this one here, that's a great way to reinforce. So we're getting into a control exercise here. So think of how you could go through these in order. So get on your foam roller, crack some things loose. The open book is it's not completely passive. You're not working against gravity. Um, so it's some active range of motion. So you've gotten on the foam roller, restored some movement, reinforce that with the open books. Then you're going into the prayer stretch. You're working on extension again, and then reinforce all of that with the thread the needle exercise. And as you can tell, I need to do the thread the needle a little bit more. Not much range of motion happening there. Okay, I think that's all we got for mid back. Let's cruise on up to the neck. This first one here, we call these towel stacks. So grab a towel out of the kitchen or the bathroom. I've got mine folded up pretty tight, and that's so I can get more specific to maybe not one segment, but getting down closer to where we can affect 1 or 2 segments. So whichever way, like if I'm turning to my left hand is going to stay down on my chest, and my right hand is going to kind of scoop up towards my eye. So I'm getting a little bit of a lift as I apply that rotation with the towel. So just think of this as an assisted rotation. Um, and then the next one here, I've got the a strap, or you can use a belt, or if you've got a big towel, that works as well. And I'm just kind of anchoring down my first and second rib with that towel or belt. And if you remember back to some of the previous episodes, your scalene muscle group attaches to your first and your second rib. So if you kind of tack those down with something external, you're going to get a whole lot more of a stretch on those versus we tend to just do the body lean and we're not really getting that much stretch on those scalenes. You're going to stretch your upper traps with this stretch a little bit as well. Okay, the next one, we're getting after that levator scapula, and I know we didn't necessarily talk about that specifically, but we'll get into it more with the shoulder episodes, but it attaches up on these on C1, 2, 3, 4, so it's relevant to what we're talking about now. You're going to turn about halfway and then bring your chin down towards your collarbone and then apply that extra pull with your hand. Your direction of force is down this way, and the stretch should be right along where that muscle lays. Okay, so this next one, you're in a hands and knees position, and there is a little bit of this can be a tricky exercise because we don't always have great postural awareness through our neck, unfortunately. So there's a little bit of rotation, a little bit of that kind of motion, but it's mostly retraction, protraction. Okay. And at the top of that movement, I feel some pressure kind of right where my neck meets my upper back. Let's move on. And guys, ask questions about these. I know I'm going through this relatively quickly, but I want to get this all in. So this next one is a very similar movement. You're upright, you're sitting, so it does take a little bit. I'm not going to say more, different control. And the big difference with this one, so you're still doing that retraction, but then your goal is to get extension from the bottom up. So if you remember, we have the most freedom of movement at the upper cervical segments. So that's why I stop when I get to that, where I stop each time. I stop there because the only place I have left to move from is the upper cervical segments, and that's not the goal of this exercise. We want to force, I use that, we want to gently force some movement at those lower cervical, upper thoracic segments. This does not feel good. I feel a lot of pressure in that same region, but that tells me I'm getting something done. I'm moving some joints that aren't moving so well. So that's not necessarily a bad thing. Not everything has to feel fantastic, right? Okay, and then the last one, think a diagonal movement, and you can use your nose as your frame of reference, but the difficulty most people have with this is you've got three different movements happening here. So you're coming from a flexed position, so you're getting some extension. You're coming from a side bent or laterally flexed position, so you're coming out of that. You're coming from a rotated position, so you're rotating out of that. You want to put all three of those movements together, and this is what this movement usually looks like. And that's only rotation. It takes some practice. It can be helpful to do it in front of a mirror. So each time you come up through here, you're in neutral. You can look at yourself and say that you're there, and then you can continue on the rest of the motion. Come back through that neutral position. After you've practiced a little bit, maybe you don't have to stop in the middle, but I would say stop in the middle until you start to build some awareness of where you are in space. That sounds silly, but it's something that we lose, and we'll think this is neutral or this is neutral. So putting yourself there, getting some visual feedback, that can be super helpful. Okay, I think that's all we got for episode 4, section 2. Stay tuned for section 3. Guys, thanks for watching. Please reach out if you got any questions, if anything needs clarification, and look forward to section 3. Have a good one.